Finally, I found a short clip where one of the mainstream media put out and made it clear that Donald Trump cuts, and specifically cuts in Medicaid, is going to hurt the red states much more so than it will hurt blue states or blue areas. I mean, yes, they've been doing this here and there. Yeah, red states are going to be hurt by the Trump cuts. But right here, what they did is they brought a CEO of a hospital system who made it clear how these cuts are going to affect these red states, these rural areas, and why. I want you to listen to this, and then we'll take it on the other side.
Chief Executive Officer at the Lincoln Community Hospital and Care Center in rural Colorado, Kevin Stansbury. Kevin is the author of a recent guest essay for the New York Times entitled "What Medicaid Cuts Would Do to My Rural Hospital." In it, Kevin writes in part this: "The proud conservative residents of our community often feel left out of Colorado's more liberal politics. Our voices never seem to be as loud as those in metro areas of the state, and yet, with the looming threat of Medicaid cuts at the federal level and budget proposals that would cut rural health care, we're wondering if our voices are heard at all in this Republican administration and Congress. The nation's food and fuel are sourced in rural areas. Supporting rural communities should be strategically important, and they can't thrive without health care. I know the financial peril my hospital will face if our Medicaid lifeline is severed. But the real damage, the kind that keeps me up at night, will be done to the hard-working people in my rural community." And Kevin, thank you so much for coming on. Could you tell us more about what you think is at stake for the people that your hospital serves?
Good morning, Mika, and thank you for that summary of the article. I think it's first important to understand the nature of rural hospitals. Many rural hospitals in Colorado and across the country are independent community hospitals. We're not affiliated with systems. We have boards that are appointed from the community, and we're really trying to take care of our community members. We're also very geographic dispersed. So in my hospital, we serve an area roughly the size of the state of Connecticut, but there's only about 2 people per square mile in there. So what that creates is this dynamic where the hospital ends up, because of its community focus, we end up offering a lot of services that may not be financially lucrative, but are necessary to support the members of our community. So services like long-term care, services like home health, ambulance services. Many of those services are not necessarily financially sustainable on their own, but we offer them anyway because they're important to our community members. Without the Medicaid funding for those services, that's going to put rural hospitals in an even deeper hole, a hole that has been growing since the end of the pandemic. So we have to figure out a way how to continue to offer those services in rural communities, and at the same time, take a look at what's the best way to manage these Medicaid costs that the Congress is trying to look at right now.
Yeah. I mean, if they weren't able to access the care that they need at your hospital, where would residents in your community go for health care?
So the next nearest hospital to us is roughly 85 miles away in either Denver or Colorado Springs. They're about equidistant from us. And so what that creates is patients don't often go into the city because they're busy working at their jobs, either on the farm or the ranch. So if we don't offer care locally, often that care goes away. And some of the most important care that we offer is services like primary care and chronic disease management. And I would suggest that there's an investment in paying for those services because we can provide care at a relatively low cost to manage those chronic diseases instead of letting them become more acute when they really have to then present to the emergency department at a much higher cost of care.
Kevin, I'm Sanders Townsend here. You know, last night on our show, we talked to a Republican congresswoman from Indiana who said, look, they really want to make the benefits better for people and to crack down on the companies and the hospitals that take advantage of folks. But I just want to cut through the mess for a little bit. What would it mean if Congress ended up putting a cap on the amount that the federal government sends to the states for Medicaid patients. Would your state be able to make that up so that folks don't lose care? Can you guarantee that?
No, I don't think anybody can guarantee that. And I think all of the states, especially Colorado, what I know most about, the state would be hard pressed to make up the difference from the federal government right now. Promises were made, programs were developed based on those promises. And that in Colorado and in my hospital, those funds that we get from Medicaid keep our doors open.
So yeah, Donald Trump doesn't care about anyone. And worse, he cares very little about the people who see him as their Führer, who sees him as their God, who sees them as the return of Jesus Christ. He cares nothing about them. But what he does is he strokes on their prejudices, and in stroking their prejudices, he can get them to do what he wants. He can puppeteer these guys. Now, to our MAGA base, I say this, and I say this often. One would be surprised how much MAGA has in common with all the rest of the country who right now find themselves in dire straits or near dire straits. So I think as we continue to educate, as we continue to inform, those who have a mind, those who are not driven completely by the indoctrination or by a certain hate that allows them to be irrational, will eventually see the light. And when that occurs, the chickens are going to come home to roost.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number 1, subscribe to our channel. And number 2, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.